There's a forbidden sleeping position millions of seniors use every single night that may be quietly starving your brain of oxygen for 8 hours straight, and your doctor has never warned you about it. Look, I'm going to say something that might shake you a little, but you need to hear it. Last night, while you were peacefully asleep, your brain may have been struggling, not because of disease, not because of medication, not because of anything you ate, but because of the exact angle your head was resting in when you closed your eyes. And here's the part that stops most people cold. Stroke risk peaks in the morning hours after waking, with research showing up to a 49% increase between 6 a.m. and noon, driven by what cardiologists call the morning blood pressure surge. That isn't random. That isn't bad luck. What you do in the 8 hours before that window directly determines whether your cardiovascular system survives it gracefully or gets blindsided. Before we go one second further, let me introduce myself properly. I want you to know something right up front. I do not make a single video on this channel without diving deep into peer-reviewed research, cross-checking findings from institutions like the Mayo Clinic, Johns Hopkins, Harvard Medical School, and the Cleveland Clinic. Every word I share with you is filtered through that lens, and I give you my 100% honest opinion. Not what some pharmaceutical sponsor wants me to say, not what's trending on social media, just what the science actually shows. So you can be educated, empowered, and finally take real control of your own health after 60. That's the promise I make to you on every single video. So stay with me, because in the next 25 minutes, I'm going to walk you through 6 sleeping mistakes ranked from surprisingly harmful to genuinely dangerous. And then I'm going to give you 2 evidence-backed positions that could be doing your brain and your heart a real favor starting tonight. But first, do me a small favor. Pause for a second and drop a comment below telling me, are you a back sleeper, a side sleeper, or a stomach sleeper? I'll be referencing all 3 throughout this video, and your answer is going to matter very soon. All right, let me give you some context, because if you understand the why, everything else is going to click into place. When you're young, in your 20s, 30s, even your 40s, your blood vessels are elastic. They stretch, they bounce back, they quietly correct for almost any position you sleep in. You wake up with a stiff neck, you shake it off, and that's the end of it. But here is the reality. After 60, the rules change. Your arterial walls begin to stiffen. The tiny vessels feeding your brain become less flexible. The pressure inside your skull becomes more sensitive to position changes. And your blood pressure regulation system, the one that's supposed to keep everything balanced overnight, becomes slower, lazier, less responsive. Cardiologists at the Cleveland Clinic call this overnight blood pressure dipping. A healthy sleeper experiences a natural 10 to 20% drop in blood pressure during deep sleep. That dip is protective. That's your body recovering, repairing, resetting. But if your sleep position compresses the wrong vessels, restricts the wrong airway, or tilts your blood flow in the wrong direction, that protective dip gets disrupted. And what fills that gap is something far less friendly. Sustained hypertension, restricted cerebral perfusion, and silent inflammation in arteries that already have decades of wear on them. Now think about that. 8 hours a night, 365 nights a year, year after year. The cumulative damage is real. Let's get into the list. Mistake number 1, sleeping completely flat with no head elevation. This sounds harmless, doesn't it? No pillow, or just a thin one, body horizontal, spine aligned. Mattress companies build entire marketing campaigns around it. But here's what they're not telling you. When you lie completely flat after age 60, blood doesn't redistribute the way it does in a younger body. Cerebrospinal fluid, the fluid cushioning your brain inside your skull, begins to pool. Intracranial pressure edges upward. The tiny vessels in your brain that are already dealing with years of mild wear are now under elevated pressure for 7-8 hours straight. Researchers at Harvard Medical School and Stanford have documented that even modest head elevation, as little as 15 degrees, leads to measurable improvements in intracranial pressure and nighttime cerebral blood flow. Now here's the part most people miss completely. You wake up at 3 a.m. with a dull, throbbing headache, maybe behind your eyes, maybe at the base of your skull. You think, I'm getting older, headaches happen. You drink some water, maybe take an ibuprofen, and go back to sleep. But what if that headache is actually your brain screaming that the pressure in here is too high and has been too high for hours? That's not aging. That's a warning signal. Mistake number 2, stomach sleeping, the position that twists everything. I know, it feels harmless, right? You're not putting weight on your heart. You're not crushing your lungs. What's the big deal? The big deal is your neck. When you sleep on your stomach, you physically cannot breathe with your face flat into the mattress. So what do? You rotate your head to one side, and almost always the same side every single night, because we are creatures of habit. Now think about what's happening structurally. Your neck is rotated up to 90 degrees for 7, 8, sometimes 9 hours per night. And running along the sides of your cervical spine are 2 arteries, called the vertebral arteries. These vessels carry blood directly to your brainstem, your cerebellum, and the regions of your brain responsible for balance, breathing regulation, and coordination. When your neck stays rotated for prolonged periods, these arteries become kinked. Think of it like stepping on a garden hose. The flow doesn't stop completely, but it becomes restricted. And restricted flow to your brainstem, 8 hours a night, year after year, is not something your body simply shrugs off. Research published through Mayo Clinic networks has confirmed that extreme cervical rotation measurably reduces vertebral artery blood flow velocity. And there's a second problem. Your rib cage is pressed against the mattress. Every breath you take is fighting compression. Your diaphragm cannot fully descend. You never reach full tidal volume, the deepest, most restorative breath your lungs are capable of. Lower oxygen per breath, restricted artery, both happening simultaneously. For a 35-year-old, the body compensates. For a 68-year-old with any cardiovascular history, this is a problem building silently in the dark. If you're still with me and finding this useful, type the number 2 in the comments. It tells me you're paying attention, and it helps this video reach more seniors who genuinely need it. Mistake number 3, stacking multiple pillows under your head. 2, 3, sometimes 4 pillows piled up. People do this for real reasons. Acid reflux, sinus drainage, snoring, breathing trouble, and a small amount of elevation does help with some of these issues. I'm not dismissing that. But here's what happens when the elevation becomes excessive. Your head gets pushed forward dramatically. Your chin tilts toward your chest. And that forward bend, what clinicians call cervical flexion, is exactly the position that compresses your vertebral arteries from the front. There's also a third vessel everybody forgets about, the internal jugular vein. This vein is your brain's primary drainage pathway. It carries used, deoxygenated blood and metabolic waste back down toward your heart. When your neck is bent forward all night, jugular drainage becomes partially obstructed. Pressure inside the skull builds slowly, and your brain's overnight cleaning system gets compromised. You feel it the next morning as brain fog, heaviness behind the eyes, that frustrating sensation of waking up after 8 hours and feeling like you barely slept. You're not lazy. You're not just getting old. Your brain may have literally been waterlogged overnight. The fix? One pillow. One properly contoured pillow, ideally a memory foam cervical pillow that supports the natural curve of your neck. Many patients report their morning headaches vanish within a single week of making this one change. Quick question for you. In the comments below, how many pillows are you currently using? 1, 2, 3, or more? I genuinely read your responses and I'm curious how widespread this habit really is. Mistake number 4, right side sleeping with cardiovascular history. Now we're entering territory that's going to surprise a lot of you. Side sleeping in general is one of the better positions, but the direction you face matters more than almost anyone realizes. Your heart sits slightly left of center in your chest. When you lie on your right side, gravity pulls your heart slightly away from its natural resting orientation. More importantly, your body weight compresses the right side of your torso, and the inferior vena cava, one of the largest veins in the human body, runs directly through that region. The inferior vena cava has one job: return blood from everything below your waist back up to your heart. When you compress that vein by lying on your right side, return flow is restricted. Your heart has to work against reduced preload, which means it's pulling harder than it should just to fill each chamber properly. For a healthy 30-year-old, this is nothing. For a 65-year-old managing borderline heart function, mild heart failure, or chronic high blood pressure, your heart is already running close to its ceiling. Adding nightly resistance is like running your car engine 10% harder every single night for years. The cumulative wear is real. Cardiologists at Johns Hopkins have noted that patients with heart failure naturally and instinctively avoid right-sided sleeping. Their bodies detected the discomfort before their minds consciously identified why. That instinct is worth listening to. Mistake number 5. The tightly curled fetal position. Knees pulled up, shoulders rounded inward, chin tucked toward the chest. For many seniors, especially women, this is the default. It feels warm. It feels safe, like the body is wrapping itself in a hug. I understand the emotional appeal, but physiologically, 3 things go wrong at the same time. First, your lungs are compressed. Your rib cage cannot fully expand. Every single breath is shallower than your body needs. Tidal volume drops. Blood oxygen saturation dips incrementally with every breath across the entire night. Second, the blood vessels behind your knees, the popliteal vessels, get bent and partially compressed. Circulation to and from your lower limbs is reduced. If you already have swollen ankles or poor leg circulation, this position makes both significantly worse. Third, your neck is flexed. Same problems as before. Reduced vertebral artery flow, reduced jugular drainage. Stanford respiratory researchers have documented that sustained spinal flexion during sleep measurably reduces tidal volume. Now multiply a 10% reduction in oxygen across every breath in an 8-hour night, and you're talking about significantly less oxygen reaching aging brain tissue. The fix doesn't have to be dramatic. A body pillow between your knees, A slight opening of the hip angle. Small adjustments. Real protection. Mistake number 6. Late eating and alcohol close to bedtime. This is the most socially common mistake on this entire list. You finish dinner at 7:30, a glass of wine while watching the news. Bed by 10. That sounds like a normal evening for tens of millions of Americans over 60. Here's what's actually happening inside you. After a heavy meal, your body redirects significant blood volume away from your brain and heart toward your gut for digestion. In a younger body, this is seamless. In an older body with stiffer arteries and slower autonomic response, that shift creates transient drops in cerebral blood flow, moments where the brain is subtly undersupplied. Now add alcohol. Alcohol is a vasodilator. It widens vessels, drops your blood pressure. Then your body overcorrects by constricting and raising pressure again. Up, down, all night long. And in vessels that already have plaque or age-related fragility, that oscillation stresses arterial walls relentlessly. Researchers from Harvard's hypertension division found that even moderate alcohol within 3 hours of sleep disrupts the natural nighttime blood pressure dip. Without that dip, overnight cardiovascular strain increases dramatically. You wake up at 2 a.m., heart hammering, sweating slightly. You think it was a vivid dream. It wasn't. That was your vascular system fighting to stabilize itself through pressure waves it wasn't equipped to handle. The recommendation? Finish eating at least 3 hours before bed. If you drink alcohol, stop 4 to 5 hours before sleep. Take a 15-minute gentle walk after dinner. Not exercise, just movement. That single habit normalizes blood sugar and gives your cardiovascular system the chance to settle before you go horizontal. Now, let's talk about the 2 positions your brain actually wants. Position 1, left side sleeping. This is, without question, the most evidence-supported sleep position for cardiovascular and neurological health in adults over 60. When you sleep on your left side, gravity aligns with your heart's natural orientation. The inferior vena cava sits on the right side of your spine, so left side sleeping completely removes compression from that vein. Blood returns to the heart freely. Circulation stabilizes. Your heart works less. But here's the discovery that truly changed everything. About a decade ago, neuroscientists at the University of Rochester, and later confirmed by teams at Johns Hopkins, identified a system called the glymphatic system. Think of it as your brain's overnight janitorial crew. While you sleep, cerebrospinal fluid pulses through the spaces between your brain cells, flushing out metabolic waste products, including amyloid beta and tau proteins, the same proteins found in dangerously high levels in the brains of Alzheimer's patients. A landmark study published in the Journal of Neuroscience found that this glymphatic clearance is most efficient when you sleep on your side, and the left side appears to offer slightly better drainage geometry due to the brain's natural asymmetry. Why hasn't your clinic told you this? I genuinely don't know, but this means left side sleeping isn't just about tonight's circulation. It's about whether your brain is adequately clearing the waste products that, over decades, accumulate into cognitive decline. If you've never been a side sleeper, use a full-length body pillow to support your front. Place a pillow between your knees to keep your spine neutral. Give it 7 days. Your body adapts faster than you think. Position 2, back sleeping with a 15-degree elevation. For those who genuinely cannot tolerate side sleeping due to shoulder arthritis or decades of habit, there's a safe alternative. Elevate your upper body 15 to 30 degrees. Not just stacking pillows under your head, but the entire upper torso on a gradual incline. A wedge pillow works. An adjustable bed frame works even better. This uses gravity to assist blood return from your lower body. It reduces pooling pressure on the brain. It keeps your airway more open all night. Add a small pillow under your knees to maintain the natural lumbar curve, and you achieve what sleep researchers call zero gravity posture. Pressure distributed evenly across your entire body. And one more thing, your sleep environment matters as much as your position. Keep your bedroom between 65 and 68 degrees Fahrenheit. A cooler room helps your core temperature drop, which is the trigger for deep restorative sleep. Cut blue light from phones and tablets after 9 p.m. It suppresses melatonin and delays deep sleep, which is when your glymphatic system actually does its cleaning. And consider an overnight pulse oximeter, a small clip-on device that tracks blood oxygen all night. If your oxygen regularly drops below 92%, that's a serious conversation to have with your doctor. It can point to sleep apnea, circulation issues, or early respiratory problems, all of which significantly raise stroke risk. Here's what I want you to take away tonight. Your stroke risk does not clock out when you fall asleep. The hours between midnight and dawn may be the most critical hours in your entire cardiovascular day. And the position your body is in during those hours is something you have direct, immediate, zero-cost control over. Pick one thing from today, just one. Switch to your left side tonight. Elevate your head 15 degrees. Stop eating 3 hours before bed. Trade 3 pillows for 1 contoured pillow. Any single change is not small. It's a nightly intervention that compounds over weeks, months, years. Now drop a comment below and tell me, which change are you making first? Reading your answers genuinely helps me understand what you're dealing with, and it might help someone else in this community recognize a pattern they've been ignoring for years. If this video gave you something your last doctor's appointment never did, please hit that like button and share it with someone you love who's over 60 and waking up tired, a spouse, a parent, a sibling. And subscribe right now, because next week I'm covering the 5 early morning symptoms cardiologists say are far more dangerous than people realize. Symptoms that show up in the first 20 minutes after waking. Symptoms most folks dismiss as just aging, but that may actually be your body sounding a very specific alarm. You won't want to miss it. Until then, sleep smart, protect your brain, and take care of yourself. I'm Senior, and I'll see you in the next one.